what everybody's talking about in health. TriHealth Pediatricians talk live about getting kids back to school safely and a new report on vaccines. It is next, live at noon.
With Liz, sponsored by TriHealth.
Welcome back. Each week at this time, we share Health Talk Live. Many of you have shared with us that you have big concerns about how to get kids back to school safely in COVID-19 times. Now, we may hear differently from Governor Mike DeWine today, but as of right now, here's what's recommended from the American Academy of Pediatrics. While reopening, they suggest everything from cleaning and disinfecting surfaces to using outdoor spaces and flexibility to go virtual if this virus surges. Here's TriHealth Infection Control Specialist Dr. Stephen Blatt talking about this.
I think with the appropriate conditions in place, it could be safely done. But again, a lot has to do with what's going on in the community. As long as the community rates are increasing, I think it will be very difficult to have students go back to school.
Now, we also asked TriHealth pediatrician Dr. Robyn Gorman in Madera more about this and the other thing we're all talking about, which is a new report that says as many as half of the kids who've been out of school are not getting the suggested vaccines. We asked her, how concerning is this to you?
That's very worrisome. Those are a lot of missed opportunities for vaccination. Also, that increases the risk of these vaccine preventable illnesses becoming a problem in the community. We are worried about outbreaks of things like measles or pertussis becoming a problem if we don't achieve high enough levels in the community to protect everyone.
So the other thing we've heard about then is we want kids to go back to school for some reasons, and yet we're nervous for a lot of other reasons. So the American Academy of Pediatrics recently said, we'd like to see kids in school. And so I've just sort of been asking pediatricians, how do you feel about that?
Yeah, I agree with the American Academy of Pediatrics. I think when it's safe to do so, kids should be physically present in school. They should be there to learn best. However, if there are outbreaks in the school or if kids are sick, they should be staying home if appropriate. So I think we just kind of stay up to date with the guidelines. It's been a changing situation, but I think right now the best way for kids to learn is at school if it's safe to do so, and also with measures in place to keep them safe. So wearing masks if possible, physically separating students, having teachers rotate rooms instead of kids rotating rooms. And then also if kids are sick, they should stay home.
Mm-hmm. And those are things you would tell them even if we had the flu going around.
And wash your hands, most importantly. Yes.
Yeah. So I think final thought, I'm curious about the one thing we keep hearing is it's very rare, but sort of that Kawasaki syndrome and that. Are parents asking you a little bit about that as well?
Yeah, I think parents are afraid of it. Parents just want their kids to be healthy and safe, and we're answering questions about that. We're able to triage based on, the exposures kids may have had, also the symptoms that they have, if that's something to be concerned about. Most kids are mildly symptomatic if they do get COVID and they're staying healthy, but there are rare cases where they do get more sick, and we're there to answer those questions.
And quick reminder, we'd love to know what you're talking about. Share it with me. You can go to Facebook, Twitter. Love to take anything you want to talk about. We'll be here every Wednesday at this time. All right, coming up